Welcome to 2022 and to the IDEAS seminar. IDEAS is the Center for Informed Democracy and Social Cybersecurity, CMU Center for looking at online harms, misinformation, disinformation, insider threat, extremism online, hate speech online, etc. We're absolutely thrilled today to kick off the season with the talk we have here by our colleagues at the University of Pittsburgh. The work that you'll be hearing about is talking about misinformation, mistrust in media, the story of COVID-19 vaccine hesitancy, which is something that, of course, we can all relate to. Our speakers, we have a pair of speakers who will be Jaime Sidani, and I probably mispronounced that, who is an assistant professor in the Department of Behavioral and Community Health Sciences at University of Pittsburgh Public Health. She's not only a trained health educator, but she's also done research on epidemiology and the prevention of emerging tobacco products, associations between media exposure and health. Lots of work on the spread of health-related information and misinformation in social media, and has done numerous presentations on COVID-19 misinformation and its potential impacts on the vaccine uptake. And joined with her colleague, Beth Hoffman, who is a PhD candidate in the same department. Her research primarily focuses on the public health implications of the portrayal of health topics on popular television programs, the spread of health information and misinformation on social media, and so on. Her research is examining the anti-vaccine movement on social media, has been featured by multiple news outlets such as CNN, the New York Times, and a documentary in February that was streamed on Hulu. It's going to be a great event, and I will turn it over to Jaime and Beth.
Awesome. Well, thank you, Dr. Carly, for the great introduction. We're really excited that our friends at CMU asked us to come here and talk today on our research about COVID-19 vaccine hesitancy. And so what we're going to do today, we think we kind of have a cool talk for you. We want to look at this in the context of history, current media, misinformation, and mistrust. Go ahead, Beth. I have no financial conflicts of interest to disclose, neither does Beth, but I did want to acknowledge the R.K. Mellon Foundation, who provided some of the support for our work in this area. All right, so looking at the goals of our talk today, first we wanted to look at the history of the anti-vaccine movement and kind of see how it relates to the current anti-vaccine rhetoric that we're experiencing today. We wanted to look at the COVID-19 infodemic and some of the factors that are related to that. And then we wanted to leave you with some suggestions for skills for how we can develop tailored messages to respond to some of the concerns about vaccines and COVID-19 vaccines specifically. All right, so I like to start off every discussion on this topic by citing this 2019 article, which says, vaccines don't save lives, vaccinations save lives. So in other words, the best vaccines in the world aren't going to do a whole lot of good if we're not actually getting them into arms. And this has kind of been the mantra throughout the past year as COVID-19 vaccines have become available. And it was amazing that we had these safe, effective vaccines available to us relatively quickly. But before that was the case, we suspected that there would be an uphill battle, both in dispersing them and also in getting people to embrace them. So although we've been hearing quite a lot about this topic of vaccine hesitancy recently, it is not a new problem. It's something that's been on the rise since even before the COVID-19 pandemic. So in 2019, the World Health Organization named vaccine hesitancy as one of the top 10 threats to global health. And this was along with other threats such as climate change and antimicrobial resistance. So what do I mean by vaccine hesitancy? In 2014, the World Health Organization gave it a definition, and that is the delay in acceptance or refusal of vaccines despite the availability of vaccine services. And there are a lot of different factors that likely contribute to this. The one that I like to highlight is confidence. So this is being confident in the vaccine itself, in the development process. So in other words, some level of trust. But also we have to consider trustworthiness. So trustworthiness of researchers, of healthcare professionals, of public health professionals. And it's also important to make a note here that vaccine hesitant doesn't necessarily mean anti-vaccine. Anti-vaccine individuals only make up about 3% of the population, whereas those who are vaccine hesitant or kind of more on the fence are a much larger subset of the population, and also they're probably more intervenable. Okay, so we can see here why the World Health Organization named vaccine hesitancy as a top 10 threat to global health by just looking at the US. So on the left, these are Gallup polls between 2001 and 2019. And so we can see that parental hesitancy toward vaccinating one's children was on the rise during that time. And this holds true for a number of different sociodemographic factors like gender, college grad, stuff like that. Also in 2019, about 46% of parents indicated that they were unsure whether certain vaccines cause autism, despite the fact that that has been debunked. We can also see from the graph on the right how this is affecting vaccination rates among young children, with non-medical exemptions for kindergarten required vaccines on the rise in many states. And as we know, the decrease in vaccination can lead to increased infections. So looking at the example here of measles, we can see that in 2019, cases in the US were the highest since they had been in 2010. And the majority of these cases were in people not vaccinated against measles. And then unfortunately, increased infections can lead to increased deaths. So this is a headline from November 2020 from the World Health Organization and the CDC, which found that the global death tally for measles in 2019 was over 207,000. And that was 50% higher than in 2016. And part of the reason for this was just that we didn't have sufficient coverage for herd immunity. And this was even more concerning in light of the pandemic, which was leading to decreased rates of childhood vaccinations. So globally at this time, about 26 countries had to suspend their vaccination campaigns because of the pandemic. And at the time that this was published, there were already measles outbreaks in half those countries.
So looking at vaccine hesitancy and thinking about how did it become such a huge problem, a big part of that is the anti-vaccine movement. And when most people think of the anti-vaccine movement, often the first thing that comes to mind is Andrew Wakefield's retracted Lancet paper from 1999, where he claimed links between the MMR vaccine and autism, and the subsequent activism of celebrities such as Jenny McCarthy and Charlie Sheen around that claim. Some may also be familiar with Andrew Wakefield's 2016 documentary Vaxxed, which also became a traveling bus tour. But the anti-vaccine movement actually begins with opposition to variolation, which was a precursor to vaccination. And variolation, which involved taking pustules from smallpox from an infected person and inserting it into somebody who is not yet infected, was believed to have been practiced in China and Turkey as early as the 11th century before coming to Europe. Then over here in what was at the time the colonies, there was a smallpox outbreak in Boston in 1721. And the Reverend Cotton Mather had read about variolation and really tried to promote it. He was able to get only one doctor on board. And the practice was opposed by many, including James Franklin, Ben Franklin's older brother, who launched the New England Courant, which is perhaps the earliest tabloid, to amplify opposition to the practice. So here's a picture of an article from The Current highlighting the belief that variolation was unnatural and unlawful. And other concerns about variolation were that it was considered Eastern medicine and it interfered with the natural course of disease history and thus violated religious law. Ultimately, though, Mather and Boylston conducted some statistical analyses showing improved survival for those who were variolated, and the practice was more widely adopted. Now, fast forwarding to the end of that century and the development of the smallpox vaccine in 1796, at first, most people were very accepting of it. And then as smallpox kind of went away and people became less concerned about it, many stopped getting vaccinated. And as a result, there were increased infections. And then there were new laws put in place to mandate smallpox vaccination. This resulted in organized opposition in the form of anti-vaccine leagues in both Great Britain and the US. And they were pretty successful at getting the repeal or modification of some laws. Although in the early 1900s, 2 Supreme Court cases that affirmed the constitutionality of mandatory vaccine laws and school requirements quieted political advocacy. Switching gears now to the polio vaccine. Currently, most of the opposition to the polio vaccine relates to concerns specific to the oral or Sabin poliovirus vaccine, such as vaccine-associated paralytic polio and vaccine-derived poliovirus. And these concerns are valid. In 2020, only Afghanistan and Pakistan had wild-type polio, but 32 countries had outbreaks from vaccine-derived poliovirus. And this is problematic because, as you can see from this Facebook post we saw when conducting a study of anti-vaccine rhetoric on Facebook, anti-vaccine activists use this as quote unquote evidence that polio is not a real virus, but rather only exists because of vaccines, and thus children should not be vaccinated against polio. And I'd also like to mention that when doing this study on Facebook, we saw that anti-vaccine activists posted a lot about what was called the Cutter incident, which refers to when 2 weeks after mass vaccination of the Salk polio vaccine began in 1955, 5 children, all of whom received a vaccine produced at Cutter Laboratories, became paralyzed. And it was determined that the virus had not been properly inactivated. The vaccine was immediately recalled. However, ultimately, 94 individuals and 166 of their close contacts developed polio from this inactivation failure. So although the response was swift and thorough, and there are safeguards to prevent this from happening again, it's important that we are mindful and know about this history instead of just brushing it under the rug. Okay, and moving into the 1970s, there were concerns about the wholesale pertussis formulation in the DTP vaccine, and that reached a tipping point in Great Britain and Japan, fueled by media reports of deaths that were claimed to have been caused by the vaccine. It took about a decade for this to travel across the ocean to the United States in our pre-social media age. And here in the US, there was a television documentary called DPT Vaccination Roulette, and a book published called A Shot in the Dark. Now, in Great Britain and Japan, the result of the activism was a decline in vaccination rates. In the US, vaccination rates held steady, but there was increased litigation against pharmaceutical companies that made vaccines. So as a result, 2 of the 3 manufacturers of the vaccine ceased production, which resulted in shortages of vaccines. So in response to this, in 1986, Congress passed the National Childhood Vaccine Injury Act, which established the Vaccine Adverse Event Reporting System, or VAERS, and made it so that individuals cannot sue pharmaceutical companies over vaccine injuries. So why do I bring this all up? I'm guessing that some of the talk about concerns over mandates and other things that I mentioned may sound very familiar to what we're seeing today. But I also want to highlight that the similarities between what we've seen in the past and today by showing this image, which is titled The Vaccination Monster. And it shows foreign medical professionals literally putting children into the jaws of danger. When I see this picture, I think of a modern day meme that would, be quickly shared across social media. Also, here is the text from a message that an anti-variolator attached to a grenade and launched through Cotton Mather's window. It was only 80 characters. So today it could have been a tweet. And thus, I would argue that the rise of the anti-vaccine movement, it's certainly been amplified by social media, but social media is not necessarily the cause. So even though it's very important to be thinking about decreasing the amount of mis and disinformation on social media, it's important to recognize that even in the absence of social media, public health still needs to be focused on addressing anti-vaccine sentiment and vaccine hesitancy more broadly. And to illustrate the ways in which social media is amplifying these arguments and techniques, I'm going to talk briefly about a study I led back in the before times. It was published in 2019, where we looked at anti-vaccine activists who attacked the social media pages of Kids Plus Pediatrics here in Pittsburgh. So on August 23rd, 2017, Kids Plus published a video about the HPV vaccine as cancer prevention. A few weeks later, the post was shared in an anti-vaccine group and began to receive thousands of distinctly anti-vaccine comments, such as, "You'll burn in hell for killing babies," and "We're in World War III. We need to be as covert as the government is and take care of business." So in total, the communications director for Kids Plus blocked almost 800 people for posting these comments over the course of 8 days. And we looked at a subset of these profiles. We looked at 125. We looked at 200, 25%. And one of the things I'd like to highlight is that for the 136 profiles for which we could determine location, only 5 were here in Pennsylvania, even though this all occurred on the Facebook page of a practice here in Pittsburgh. In fact, there were more people from Australia and Canada than Pennsylvania, showing how this event involving a local practice quickly became global through social media. And here you can see the results of our social network analysis, which found that anti-vaccine topics and individuals fell into 4 subgroups: lack of trust in the medical profession, touting alternatives to vaccines, such as homeopathic remedies, concerns about vaccine safety, and conspiracy theories. In other words, individuals against vaccines are not a monolithic group who all are concerned about the MMR vaccine causing autism. We actually saw more posts related to vaccines causing death than vaccines causing autism. We also saw that people were posting a variety of other health-related content on their Facebook pages that often fell into the alternatives or conspiracy categories, such as promoting natural remedies for cancer and raising concerns about water fluoridation. We also saw people posting conspiracy theories about technology, which is something we've been seeing with COVID-19 vaccines. And research published last May in the journal Nature, which looked at nearly 100 million people who expressed views about vaccination on Facebook, found similar results to ours. This figure is from that article. In blue are the pro-vaccine, people posting pro-vaccine views. Red are those expressing anti-vaccine, and green are undecided. Not only are the anti-vaccine clusters positioned more centrally than pro-vaccine, allowing them to dominate in outreach to those who are undecided, but qualitative analysis found that anti-vaccine clusters are better at tailoring their messages to diverse audiences like the ones we found, whereas in contrast, the pro-vaccine clusters were relatively monolithic in their message. So switching from Facebook to Twitter, recent research has found similar results. Here's a table from a 2020 American Journal of Public Health article, where the authors found that 129 Twitter accounts were responsible for over half of all anti-vaccine posts, with 15 accounts being responsible for a majority of the engagement or considered hyper-influential. The 5 most prominent themes were negative health impacts, pharma, research and clinical trials, policies and politics, and vaccine ingredients. The talking points in posts by top authors in most of these themes were very similar, which suggests high levels of coordination. In the negative health impacts, which were over half of mentions from top authors, The authors of this paper found that misinformation around deaths attributable to vaccines was more common than misinformation about vaccine-caused autism, consistent with what we saw on Facebook. Also, in posts mentioning deaths, the top authors predominantly shared a journal article citing deaths reported to theirs, which, as you may remember, was a system created in the 1980s in response to the increased litigation about the DTP vaccine. Second, and again related to the legislation in the 1980s, posts in the policies and politics theme predominantly focused on the National Childhood Vaccine Injury Act and the fact that it made it so that individuals cannot sue pharmaceutical companies. So I highlight these two things to emphasize why we wanted to explain some of this history here today, so that in the future, if you do come across some of these posts or these arguments, whether online or in the course of conversations with friends and families, you can better understand the history and where those where that legislation originated. So I mentioned that the authors of that Twitter study saw a high level of coordination among top accounts. And we actually saw the same level of coordination in a study we did evaluating the hashtag Dr. Speakup event, which occurred on March 5th, 2020, and was designed to be an event for vaccine advocates to post on Twitter about their support for vaccines. Since we saw some differing headlines after the event, we decided to investigate to look at who was posting and the proportion of pro and anti-vaccine tweets. So to do this, we collected all publicly available tweets with the Dr. Speakup hashtag from March 5th, 2020, and we had our coders assess a 5% subsample of original tweets using a thematic content analysis approach. What we found was pretty striking. First, almost 80% of the tweets were anti-vaccine. When looking at the types of accounts that authored these tweets, the most frequent were accounts from parents, followed by health professionals, and then those who identified as a parent and health professional. We also used the bottom meter application to analyze Twitter users in our sample for a likelihood of being a bot, and just over 5% were classified as likely bots, which is pretty low. Now, even though very few accounts were classified as bots, we kept seeing the same anti-vaccine tweets over and over again. This is because, as this image shows, the anti-vaccine activists had given their followers pre-written tweets to use, and they were simply copying and pasting and tweeting those over and over again. Something else we noticed is that the pro-vaccine tweets tended to be more general, with statements such as preventing disease is better than treating disease. Only about 13% contained a personal narrative, and 17% contained a statement about research or science. In contrast, almost 36% of anti-vaccine tweets contained statements about research or science, even if these statements were not correct. So although we often think of the anti-vaccine movement as using anecdotes and scientists as using research to communicate about vaccines, what we found is that of the tweets coded as presenting statements about research or science, 90% were anti-vaccine. Overall, these results suggest that we as vaccine advocates need to do a much better job at communicating about vaccines on social media. And so as a result of our study, we developed some guidelines for future vaccine advocacy that we'll discuss in depth shortly. But first, I'm going to turn it back over to Dr. Sidani to talk about COVID-19.
Thanks, Beth. All right, so coming back to COVID-19 and its effects on the infodemic and COVID-19 vaccine hesitancy. Go ahead, Beth. So I'm sure many of you have epidemic before. So just as a refresher, this term comes from the combination of two terms, information and epidemic. And this is exactly what it is. It's the rapid spread of both true and false information. And it spreads very much like an epidemic, so very quickly from person to person until it's pretty widespread. So the term was first coined in the early 2000s, but we started to hear it again a lot in 2020 when the World Health Organization realized that this was happening again with COVID-19. So one of the reasons that we're probably seeing an infodemic related to COVID-19 is this is the first pandemic in the age of widespread social media. Looking back to the last pandemic, which was H1N1, that was in 2009, and only about a third of US adults indicated using social media platforms at that time. Now it's pretty much everybody. And I also wanted to emphasize the difference between misinformation and disinformation. Misinformation is false or inaccurate information. It's not always malicious in nature. It's not always intentionally correct. Sometimes it simply comes from misunderstanding or misinterpreting a true fact. Disinformation is a little bit different. This is when misinformation or untruths are spread intentionally. So usually the spreader of disinformation has some type of agenda or some type of ulterior motive, or hopes to get a certain outcome out of spreading untrue information. So I wanted to give you an example of how the infodemic has affected vaccine acceptance. And I wanted to walk you through this example from NPR. This was an article on misinformation related to COVID-19 vaccines and infertility. So first, we're going to start with the kernel of truth. Originally, some people had started discussing on social media different changes that they were noticing to their menstrual cycle after receiving a COVID-19 vaccine. Step 2 is to find an influencer. In this case, Naomi Wolf, who's a prominent anti-vaccine activist, tweeted out a link to a Facebook group called COVID-19 Side Effects. Step 3 is piling on some related myths. In this case, Wolf also mentioned reports of bleeding oddly around vaccinated people. This blended into existing myths about vaccine shedding. Step 4 is to make waves in the mainstream media. About a week after the initial tweet, a Miami private school announced that it would no longer allow vaccinated teachers into the classroom because they were concerned that vaccinated teachers might affect unvaccinated students' menstrual cycles. That got picked up by the mainstream media, and then it further spread these myths. Finally, step 5 was reached when some prominent media personalities folded this into their existing vaccine or anti-vaccine rhetoric, further spreading it until it became prominent. And then basically the story was vaccines can make you infertile. I think we don't, oh, go ahead. Oh, and I also wanted to highlight off to the right, this humorous but still important and also kind of scary example of how fertility-related misinformation about the COVID-19 vaccine spreads through social media. So this was singer Nicki Minaj, and she tweeted out to her 22 million followers that her cousin's friend suffered from swollen testicles after receiving the vaccine. This spread so widely and so quickly that numerous health ministers from around the world and Dr. Anthony Fauci and even 50 Cent had to issue comment on it. Next. And unfortunately, the infodemic has affected vaccination rates, particularly among young people. So this is a graph from the CDC, and it breaks down the percent vaccinated by age. So looking a little bit closer, we can see that about 90% of people 65 to 74, the dashed pink line kind of up at the top, 85% of those over 75, that's the solid purple line, they're fully vaccinated. Only about 60% of those 18 to 24, which is the dotted teal line kind of in the middle, and 50% of those 12 to 17, which is the solid yellow line, are fully vaccinated. Also, even though vaccines have been approved for the younger kids, those 5 and over since November, less than 20% of them are fully vaccinated. And I guess the kind of good news is that we're not necessarily seeing huge disparities in uptake by race and ethnicity, as we were starting to see in the beginning of rollout, but we're now seeing disparities by other sociodemographic factors. This is from Pew Research Center, and it's back from September, but it still kind of holds. One of the biggest differences is by political party, with 86% of Democrats reporting being vaccinated compared to 60% of Republicans. And then we can also see differences in age, with younger people having lower vaccination rates. We can also see this with education levels. So those with lower levels of education having lower vaccination rates. Same thing with insurance status. So again, those without health insurance have lower vaccination rates. And then finally, rural residents. And I wanted to dig a little bit deeper into rural residents. So certainly the reasons behind lower COVID-19 vaccine rates in rural areas are many, and they have a lot of it's probably explained by equity issues. So lower numbers of healthcare providers, longer distances to travel to go to your healthcare providers, lack of reliable public transportation, and also insufficient internet coverage. Some of the lower vaccine uptake in rural communities might also be explained by a lack of urgency about COVID-19 itself, the importance of personal freedom, and then the lack of trust and also the lack of trustworthy messengers. And then, of course, that all ties into misinformation. And we can also see this trend continues when parents are making healthcare decisions for their children around the COVID-19 vaccine. So for the 12 to 17 age group that you can say here, over half of rural parents surveyed said that they would definitely not get their child vaccinated. And then likewise, for the 5 to 11 age group, we're seeing that same large gap. This report also found that rural residents were less likely to have people from their schools or their healthcare providers recommend that they get vaccinated or that they get their children vaccinated. And knowing that hyperlocal entities are usually relatively trusted messengers of health information, we still have a lot of work to do with these sources in rural areas to try to get out messaging to address COVID-19 vaccine hesitancy in these areas. And basically what all of this means is that vaccination rates around the US are just completely uneven. This is problematic given the need for herd immunity at the community level when it comes to combating COVID-19. So as this map from the New York Times shows, many northern and southwestern states have relatively high coverage, whereas southern and central states are lagging behind. And unfortunately, many of these states are passing laws prohibiting public universities and schools from either requiring the COVID-19 vaccine or documenting vaccine status. So this is a list of states as of August 2021 that have prohibited schools from requiring COVID-19 vaccination, even though these same states require vaccines such as the MMR and meningitis for school attendance. This also has additional ramifications. During the pandemic, Tennessee halted vaccine outreach to minors for all vaccines, not just COVID-19. And although they've reinstated some of this outreach to parents, it's really unfortunate that young people in Tennessee don't have that opportunity to receive valid science-based information about vaccines from their health department. And that increases the chances that they're going to encounter misinformation on other sources, such as the internet and social media. And then lastly, I wanted to just touch on boosters really quickly. There isn't a lot of data out yet about boosters by party affiliation, but looking at a survey from November about willingness to receive a booster, about 75% of Democrats had either gotten one already or definitely would, compared to 40% of Republicans. This was before Omicron and before the official recommendation that everybody receive a booster. So it's going to be important to see what this looks like moving forward. And then looking at data about awareness of the CDC recommendation for all adults to receive a booster, it does seem that roughly the same percent of Democrats and Republicans were aware of this, at least as of mid-December. Of concern, though, is that about 30% of Black and Hispanic adults were unaware of this recommendation compared to 20% of white adults. So we also need to examine the kinds of messages that are coming out about the vaccine and also whether or not they're reaching the public effectively. And then I'm going to turn back to Beth to round out the presentation.
Thank you so much. On that note, I'll close by talking today about what you all, as public health professionals and people invested in combating mis and disinformation about vaccines, can do to help promote vaccines and boosters, particularly on social media. So first, coming back to the infographic that came out of our research on Dr. Speakup. This is particularly applicable if you're part of a group or organization that's planning to promote vaccines on social media, but I think it's also relevant at the individual level. So the first is to learn best practices for risk communication, which we're going to go into, thankfully, in a couple slides. So check that one off. The second is to leverage partnerships. So team up with other organizations that are interested in promoting vaccines, really to amplify the reach. We also want to make sure to maximize inclusivity. The Doctor Speak Up hashtag was not very inclusive. I am a public health PhD candidate. I'm not technically a doctor. We also saw nurses and parents and teachers who were all tweeting with nurses speak up, teachers speak up, which was great, but kind of minimized the effectiveness of that Doctor Speak Up hashtag. So making sure to maximize inclusivity and really hearing from the people that are going to be involved as to what they'd like the hashtag to be is really important. Also make that list of suggested tweets and messages and responses. We saw the anti-vaccine activists do that, but not the pro-vaccine activists. And then finally, teach participants how to respond to messages clearly and compassionately. For people who ask, very legitimate, understandable questions on social media, making sure that we all know how to respond and where to direct them for factual information. Also figuring out for those who are going to be engaging in spreading disinformation, how to block or report those. I also wanted to highlight a paper that Jaime and I, along with our collaborator, Todd Wolin from Kids Plus Pediatrics, recently published in the Journal of Adolescent Health, which outlines a framework to improve vaccine uptake among adolescents. This includes the ABCs, or being active on social media, because that is where young people spend a lot of their time, building trust and trustworthiness, and capitalizing on the strengths of adolescents, including their ability to easily navigate and produce digital content. As part of this, vaccine advocates can help facilitate online information seeking by both adolescents and adults by teaching media literacy. Media literacy, to put it plainly, is learning how to evaluate what someone sees in the media. There's a lot to learn about media literacy, and we could do a whole presentation just on it. But basically, it boils down to asking a bunch of questions. One method, called the SIFT method, encourages people to first stop and ask whether you know the website or the source of the information, and what the reputation of both the claim and the website is. Also to think about what your purpose is of using the source. Are you just trying to get a high-level explanation, or are you doing deep research for an academic paper? The second step is to investigate the source. One way to do this is to use a fact-checking site. Another is even just to Google the source to see what others say about it. Next, find better or trusted coverage related to the claim that your original source is making. This can involve looking at multiple sources to see if there is a consensus. And finally, looking to see if the original sources of claims and quotes have been edited or spliced, which could distort their meaning. Another acronym is the SHEEP method, which is kind of similar. And each letter in SHEEP is part of how to evaluate the source. So some key questions are, again, looking at what is the source. Also looking at what is the history of this source. An example of that, there's a group called the National Vaccine Information Center, which, just when I say that name, sounds pretty unbiased. But if you look further, you could see that it was founded in the 1970s over concerns about the pertussis vaccine, and has consistently shared only anti-vaccine related sources. So next we can look at the evidence, and then also think about emotion, if this post or source is trying to rely on emotion to make a point or playing to particular emotions. And finally, thinking about what the pictures or images are conveying. Why are they being used, and do they match the text of the source? The University of Pittsburgh Library site also has a guide to checking your facts, which includes a strategy for evaluating sources, as well as this really helpful infographic about cognitive biases that can affect decision-making about sources and facts. I'm not going to go through all 20 of them here today. I just wanted to highlight some, such as confirmation bias. Oh, that should be highlighting the one on the previous box, although conservation bias is important as well. But confirmation bias is listening for information that confirms what we already think. There's also zero risk bias, which is when we look for something that is 100% certain and don't deal well with things that have more nuance. This is particularly relevant to COVID-19 vaccines, especially with Omicron, as being vaccinated and boosted greatly reduces your risk of getting infected, but it doesn't eliminate risk. And this has been a point that has been very difficult to convey. One analogy I've tried to use lately is to liken it to wearing a seatbelt. Seatbelts overwhelmingly protect us when we're in the car, but they don't completely eliminate risk. And we also wanted to leave you with some tips from PEN America about how to talk to people in your life, if or more likely when they mention something that could be misinformation. So the first step here is similar to what I talked about in the SIFT method, which is verifying using a fact checker like PolitiFact or Snopes.com. Second is to engage with empathy. We've all accidentally shared misinformation. And so I think it's important to acknowledge that. I often tell a story of one time when I shared an Onion article, but it was before I knew what the Onion was and I thought it was true. If it's something you're seeing on social media, it's usually best to private message the person instead of commenting publicly, as public comments can boost the misinformation into more news feeds and also can make people more defensive. But if the post is already getting a lot of attention or it was public to begin with, then it can be best to comment publicly so you can reach all the people who are already engaged with the post. As much as possible, try to avoid escalation. If the person is resistant, offer tools to fact check and counter by sharing credible information on your own social media. And finally, be a resource for others, not just in sharing credible information, but in modeling fact checking. So on that note, we're going to close today by talking about some resources that you can use to be a resource for others. And as I go through these slides, Dr. Sidani is going to pop the links in the chat so that you have them to use. So excitingly, starting today, Johns Hopkins is offering a free Coursera course on talking to vaccine hesitant parents about COVID-19 vaccines for their children. So I'd encourage you all to take this training and also share the link to it with teachers, friends, and other vaccine advocates, particularly those that work with young people. Here on the left is a link for the nonprofit organization Shots Heard, which was formed here in Pittsburgh in the aftermath of the Kids Plus attack. It consists of a fully vetted group of volunteers that come to the rescue of people or groups that get attacked on social media by anti-vaccine activists. But the Facebook group is also a really great source of information about different trending misinformation and vaccine advocacy work being done globally. On the right is the United Nations Initiative Verified. If you sign up at the website listed here, you'll receive trusted information from the United Nations to share on social media and with loved ones. And this is about vaccines as well as mask wearing and other ways to prevent the spread of COVID-19. Here is also some information about Science Up First, which originated in Canada. This organization's posts are great for sharing vetted information. And on the website, you can also join the team of fact checkers if you have a science background. Finally, on this slide is a link to the United Nations Take Care Before You Share campaign. This is a media literacy campaign that acknowledges that right now emotions, especially fear, are running high, making us all more vulnerable to sharing misinformation. And there are excellent videos, GIFs, and more in many, many languages that you can share from this page to promote media literacy. And here's also our contact information, both our Twitter handles as well as emails if anybody has any remaining questions after we're done today or just would like to get in touch.